I'm going to make a joke at the very start.
Welcome to Fireside Chat. I'm Sue. Thank you so much for spending time with us. So honored to have my returning champion, Dr. Christopher Passalacqua. Welcome, Dr.
Thank you.
Christopher.
Thank you.
So nice to have
We've
you
never
back.
done a live one, so I just want to know if there's anything between my teeth.
No, there's not. No
Thank you.
broccoli,
The-
right?
Right. Thank
His
you.
my hair's sticking up. Like
Yeah, perfect. As long as the live audience isn't sickened, we're okay.
We're okay. Absolutely. So, yeah, we always have so much to talk about, and I just love learning from you because you always approach a subject from, in a sense, like multifacets. So something isn't just physical, like there's a psychological and like an emotional there's everything is so multi-layered, and I love that about you because it isn't just chiropractic. That's kind of like the beginning point, but my gosh, there's so much that
Absolutely.
you've learned over the years.
Yeah, for sure. How does one separate body into mind and into soul and into emotions and into mentality and physicality? It's one unit.
You're right.
It's one unit. My heart is not going to survive without a liver. My liver is not going to survive without my thyroid. They all work homogeneously and automatically together. We're a fearfully and wonderfully made entity for sure.
I love that.
So we can't separate them out.
No, it's true. And things actually, it's almost like an orchestra, right?
Absolutely. I play the tuba.
Oh, you do? I didn't
I really
know
don't.
that.
I really don't. I play the radio. That's all.
I've never had anyone tell me I played the tuba in jest. You're hilarious.
Well, there it is. Our first one. The court jester's back in session.
Yes, that's right. That's right. So what did you think would be good for us to talk about today?
You and I have texted back and forth recently, and both of us have concerns about, quote-unquote, an aging population.
Yes.
We know that Medicare is we care for the elderly. We know that Medicaid, we aid the poor or needy. But Medicare is expanding. The baby boomers are getting bigger. The population is growing. And so along with getting older is a term called senescence. And senescence is a scientific term that basically says, look, there is a process of degradation or decline that goes along with aging.
Wow.
And so there is a whole field of study for older people called gerontology. And so you get the old vitamin geritol.
Yeah.
Gerontology is really the study of older people.
Okay.
And so as I'm aging, my practice is aging along with me. We do see lots of young kids. We see lots of families still. But the people who I've been taking care of for the last 25, 30, going on 39 years now, they're getting older with me. And so now I'm beginning to notice not only that there are things happening to my patients.
Yeah.
It's kind of like I'm not just a member of the hair replacement club. I'm the president too. So I'm along with them. And some of these changes that you and I have talked about,
Yes.
I'm experiencing the same thing. So as I prepared a little cheat sheet, some things that we can talk about today,
Awesome.
I came across a statement by a fellow by the name of The Captain, who I follow on the internet. He gives very pithy little quotes and insights, and at first your ego gets in the way and says, I don't know what this guy's talking about, and then you realize when nobody's around, he's pretty much spot on. So he says this: the reason getting older can be so fucking hard is because new stages of life will require us to change who we are. And the more we cling to our old selves or old way of doing things, the more it feels like life is conspiring against us, when in reality, we are conspiring against life by refusing to change.
So good.
And if there's one thing that we know is constant, it's going to be change.
That's right.
And if we don't change, you're the dinosaur. And I'm realizing now that as a practitioner of going on 40 years, I'm the dinosaur in the profession. So I still have to change by studying constantly, taking in new information, doing things like you and I are doing. 10 years ago, if someone said a podcast, I would say, no, thank you. I don't subscribe to that because I didn't know what one was.
Right.
So as times change, the medium of exchange of information has grown. We've gone through cycles of presidencies and opinions. But basic information doesn't change.
Right.
And we went through a whole
Science.
series of trust the science. Okay, well, science never is settled. That's why we keep on doing experiments.
That's true.
But we do know that there is a foundation to science. And the idea behind this senescence, the condition or process of deterioration with age, we have systems that are affected. So if you don't mind, what I'd like to go is through some of these systems and things we need to be paying attention to. And then we'll go over some subcategories which fall under these systemic changes.
Okay.
And then a 10-point working plan on what should I be paying attention to if I'm someone who's listening right now.
Right.
What can I do in order to stave off some of the effects of aging or this senescence.
Okay, good. Yeah, I like that because then it's like, what can we do? When you hear about all these points, you're like, okay, what can we do?
So let's start with the easy one,
Please.
muscle mass and strength. So a classic is a condition called sarcopenia.
Okay.
And sarcopenia is a loss or weakening of muscle mass. And that is a normal process
Okay.
as we're getting aged. And so I'm a bodybuilder and I'm here in my, bikini posing for muscle and fitness, right? I'm not going to look the same when I'm 65 doing the same thing. There is going to be a loss of muscle mass.
Okay.
There comes a point where you will no longer put on muscle mass, you will no longer put on muscle size.
Wow.
But what you want to do is you want to be able to maintain certain things like mobility, stability, balance within the system, a modicum of strength, meaning I can go ahead and vacuum the house. I can get the groceries out of the trunk of the car.
Right.
And what we have to understand is that although we are going to participate in that senescent part of the system breaking down, we can slow that process down. Everything that we're going to talk about today, we can slow down through this 10-point working plan.
Excellent.
But one thing that we have to understand as we age, if you and I are going out for a steak, what kind of steak is going to be the best? Oh, let's get a Kobe beef or let's get Wagyu beef. Okay, that has fatty infiltration and fatty marbling through the steak. It's great on your plate, especially medium rare with garlic. Love it. But as we age, we have the same thing. We'll have a fatty infiltration into our muscles, which make them saggy, right? They're not as strong. If I make a muscle, it doesn't look like the same as a 20-year-old making his muscle,
Okay.
because there's going to be fatty infiltration within the skeletal muscle tissue.
Wow.
There can be fatty infiltration in smooth muscle, which is your tongue, uterus. There can be cardiac, obviously, is your heart. There's a certain amount of fat that's always around your heart for protective purposes, but you
Okay.
can have fatty infiltration even within cardiac tissue. And again, it's not as strong and it's not as resilient. If we wanted to use two words that senescence really indicates, is that you lose plasticity and resiliency and elasticity of tissue. And if we can go even lower than tissue, that would constitute the cells of our body. They're no longer as elastic or plastic or resilient as it is.
Resilient, yeah.
For example, you and I go work out, we're 25, we do a really hard workout, right? We get up the next day, kind of sore, no big deal. Okay, you and I work out today, we do the same workout, we're sore for 5 days. Our ability to recover is not what it once was because
longer.
of exactly this thing called senescence, the normal degradation or decline simply due to the process of aging.
Okay.
The next system that we want to look at for women, more than men, but men will be affected by it, are the changes in bone density.
Okay.
And so women are very concerned with something called osteoporosis.
Yes.
I believe that osteoporosis affects women 4 times as much as it affects men, but it doesn't stop because you're a man.
Okay.
There's a lot of hormonal changes that go on within the system that creates osteoporosis. But before we get to osteoporosis, we go through a process called osteopenia. We're losing the bone density, the structures that are in there, the chemistry and the electrolytes that make up a strong bone. And then you lose it and you go so much, and then you lose it to the point of being osteoporotic.
Okay.
We can see that on x-ray. There are
Like
techniques that we can look at with wrist. We can look at the pelvis. We can look at ankles, bone density tests. The big thing is that there is a risk of fracture,
Yes.
right? And so the old
Yes.
school used to say, you break your hip and fall down. Not so much anymore. What we're actually finding out is that you fall down and the impact breaks your hip.
Wow.
And one of the things that a very large percentage of people fall down is the use of medications. Their vision is off, their balance is off, their equilibrium is off. And then another one is you and I wear glasses. And
Yes.
I put my glasses on. These are reading glasses. I don't take them off. I miss a step. And I fall down because my vision is not right. Maybe my prescription isn't right. So there's many inductions into why somebody's going to fall.
Right.
The ultimate is, if you fall down, what is the consequence? At 62, I'm no longer interested in skiing. I don't want to snow ski. I don't want to water ski. I don't want to fall down anymore. I fall down enough as it is. And so you always risk the injury
Yeah.
in something that's going to be osteopenic or osteoporotic. A whole nother discussion can be for things like, I think, what is it, Boniva, things that are for women of osteoporosis. There's a certain amount of trouble that goes along with using drugs in an osteoporotic situation.
Okay.
So we'll go over that at the very end.
Okay.
Still the number one cause of death in America is cardiovascular disease. And so we know that there's going to be a reduced amount of cardiovascular function for people as they age. And as we increase age, we also increase the risk of running heart disease.
Okay.
Heart disease is the number one killer. A patient asked me the other day about statins, and I said, well, that's fantastic. I said, more people are taking statins than ever before. So what are we taking statins for? Well, we're going to reduce the risk of heart disease, heart attack, and stroke. Okay? If you go on the side of a statin, it'll say in the little package, this does not reduce the risk of heart disease, heart attack, and stroke.
It says right on the package?
Right on the package. So my question is, if all these people are taking all these things to prevent heart disease, how come heart disease is still the number one killer of Americans?
Wow.
But let's look at something that's very simple. Do the average grandma and grandpa exercise? Probably not. Do the average grandma and grandpa like desserts after dinner?
Yes.
Sure. Are grandma and grandpa usually more sedentary? Sure.
Absolutely.
What they're doing is they're increasing the risk of cardiovascular disease.
Just from their lifestyle.
Just from their lifestyle. And most of the chronic illnesses, for example, whether you like it or not, RFK Jr. is the new HHS
Health, yeah.
czar. Good for him. He does want to make some nice changes. I don't want to turn this into anything political because it doesn't need to be. But I don't find it to be a problem that we're interested in making kids and adults healthy like they ought to be.
Yeah.
And so when you're looking at lifestyles, as you and I just said,
Yeah.
heart disease still ranks as number one. Starting your day with a bowl of cereal, you're asking for problems. Lucky Charms is not magically delicious.
No.
It's magically malnutritious.
Oh, my God.
And so we have to look that there are some strategies that we'll go over for
yeah.
that.
There's a couple things that, like, I don't know, like to kind of reduce things that aren't good for you, whatever it is. Like, okay, like to get rid of red dyes that are harmful, that are not allowed in other countries. Okay.
Correct.
Right?
Right. I don't think in 4 years he's going to overhaul everything. There are things that I would like to see him overhaul as a healthcare practitioner. There's other things that, as I was having a conversation with a friend of mine last night, there's a lot of money in healthcare. There's a lot of money in drugs. There's
True.
a lot of money in, quote unquote, the medical system. And so when you're looking at an industrial medical pharmaceutical complex, you're looking at a dragon that is not willing to be slayed
No.
very readily. But that's a whole other discussion. Let's keep moving on here.
It's big.
One of the things that we find as we get older is slower metabolism,
Okay.
weight management. Again, we know from physics that objects at rest tend to stay at rest.
Yes.
And so it's hard to get off that couch.
Inertia.
And that's right. Law of inertia, exactly right. Law of motion says what? Objects that are in motion tend to stay in motion.
yes.
And so that's where you get out and you get some moving. We can discuss the strategies at the end, as we said before, but just getting to understand that your metabolism is much slower.
Okay.
For example, I have women who will come to see me, Dr. Christopher, I'm going through menopause. Fantastic, I have menopause. Everything starts slowing down. We don't move as fast. We don't have the elasticity and resiliency as we talked about before with muscle masses and reduced
like skin
cardiovascular
and stuff
function.
too, right? They might say my skin isn't the same. Or...
Absolutely. It goes through every system. And so when we're slowing down our metabolism, what is natural? Weight gain, because we're
Yes.
not burning the calories as much as we did when we were younger. Just our metabolism. There are people who have high metabolisms. I can eat a gallon of ice cream and still look good in my bikini. Well, I can't anymore, and so I don't. But we know that we're going to increase or decrease, the amount of energy that we have. Energy cannot be created nor destroyed. It simply has the ability to change forms. And so in order to create more energy, you have to expend more energy. And that means getting off your duff, getting off the couch, turning off Jeopardy, going for a little walk after dinner. But one of the things that RFK does recognize is that there are chronic diseases that are happening to kids that we would never have seen in the 50s, 60s, or 70s. This is the first generation, and I don't know the boomer, the X, the Y, the whatever.
Yeah.
But this generation of teenagers right now is not expected to outlive us, and that would be the first generation that is not outliving their parents.
That's shocking.
And when you look at the chronic diseases that these kids are suffering with, they're having old person diseases, gerontologic diseases in their late teens and early 20s
that's
because of the lifestyles that they're choosing.
Wow.
And one of the things that is big right now, I've done some research into it, is chronic inflammation.
Yes.
You and I have talked before that Alzheimer's is now being categorized as type 3 diabetes, which really is an inflammatory condition within the system because of insulin, non-insulin production, lifestyle changes, all kinds of wonderful things. People who have too much sugar, too much sweets, too much junk food, polyunsaturated fats, create all kinds of problem. Kids are coming up with fatty liver disease.
That's crazy.
Non-alcoholic fatty liver disease. And that's because of the things that they're putting in their system. The food industry knows, by the way, the food industry, junk food industry, was bought out by the tobacco industry. The tobacco industry is really super good at getting people addicted to things. And so you have to understand that if you took a Dorito, whenever I go on a hike, and I know that I could possibly be lost, I take a bag of Doritos with me because they're flammable. It's a great way to start a campfire.
What is in there that it's flammable? That's a worry.
That's the chemistry that gets people addicted, and they know that. That's why. Remember Lay's potato chips?
Yes.
You cannot have
just one. That's
and
so
they know
true.
it because they have made the chemistry on there addictive to food.
That's mean, Dr. Christopher.
Well,
that's mean.
My friend, life is mean. Get a helmet. It's hard in case you fall down. So the chronic inflammation is a problem. There's something that if anybody really wants to talk about it, we'll just throw these words out there. It's something called oxidative stress, and there's something called mitochondria, metabolic dysfunction. And the metabolic dysfunction is that even within the components of a cell, they can begin to degenerate, something called the mitochondria, which is the powerhouse of the cell. If the cell isn't healthy, we're having metabolic dysfunction. And two things that normally always create metabolic health is diet and exercise. Now, are there branches from that? Sure, we can go over that at the very end. But when kids are sedentary, I have a lot of kids who come in and their parents will ask me about video games. My kid's always playing video games. I said, you number one, be the parent and say you have 1 hour to play video games, and then there's no more. Because it'd be like, if I said to you and I, Sue, we're going to play video games, and we played video games for 6 hours straight. You would say, okay, well, that's a problem. What about someone who watches TV for 6 hours? What about someone who does nothing but sit down and listen to the radio for 6 hours?
Kind of the same thing.
How about on their phone for 6 hours?
Right.
Right? Same thing. And so in creating that sedentary lifestyle, you're actually creating the metabolic dysfunction and oxidative stress. Every time I work out, every time I flex my muscles, every time I move, I'm using oxygen to create that. I must have oxygen. I must have nutrients. I must have blood going to it. I have hormones, oxygen, nutrients, all carried by the red blood cells. It has to perform. Whenever I give off oxygen, I'm creating an oxidative stress.
Okay.
And so oxidation reduction would be like rust, but oxidation reduction in our system creates something called something bodies, and I can't think of the name of it right now. It'll come to me as soon as we move on to something else. But what ends up happening is it ends up scarring the problem. It ends up residual bodies. Residual bodies. And when residual bodies add up, it creates the oxidative stress.
Okay.
Here's the problem. What is the number one way to produce oxidative stress? Breathing. Because you have to have oxygen. So every time you breathe, you're creating an oxidative stress.
My God.
Well, what happens when you exercise?
You breathe, it
Even
affects
harder,
your breathing.
right?
Like it's a lot more
Absolutely.
demand.
Absolutely. So there's that delicate balance between oxidative stress, metabolic function, and exercising. So what do we do to recover? We'll talk about that at the end. How about changes in vision and hearing?
Okay.
Right?
Those are big.
Those are huge.
Everybody
right?
notices that.
Everybody know what? See, I mean, and it's nothing unusual to lose some hearing as we get older. There's crystals that can form in the ear.
Right.
Right. Your eighth cranial nerve, the vestibulocochlear nerve, not only creates balance in there, but it also allows you to hear.
Okay.
And if there can be a problem with that, tinnitus is another one.
Yes.
General hearing loss that you don't notice, but wives will come in and say to me, can you say something to my husband about getting his hearing checked? He plays the TV and the radio so loud that my china is vibrating in the cabinet. He can't hear that. I understand that. He can't hear that. The famous line from people who are getting older when you talk to them is what? what? And they ask the
What?
question, what? Because they don't hear.
And they don't understand. Like, I think what also happens too is like when you first start to lose a little bit of hearing, you don't really hear p and duh and all that.
Correct.
So you're sort of like, it's a cognitive load because the brain is constantly trying to guess what you're not really hearing, and you're trying to piece together what somebody else is saying.
Right. They have actually run some studies that show one of the things that the brain is extremely good at is wanting completion.
Yeah.
And so, as we
Yeah.
talked before, why are lineups not allowed in the court of law? Because our brains are programmed to say, well, he kind of looks like it, and that will be a complete thing for my brain to accept. And it may not be him. And so, or her, whoever, that person. So the brain loves completion.
Brain loves completion.
Another thing is there's a difference between reading glasses and prescription glasses.
Yes.
I tell my patients, if you're having prescription problems, you need to make an appointment with your eye doctor at least once a year, once every 18 months, just to get checked. If everything's fine, cool. But what if it isn't? And we said before, for older people, especially older gals, their prescription may not be right. Their reading glasses may not be strong. I see people driving all the time with their reading glasses, and they're driving. I think, how are you seeing through the reading glasses?
Oh my God.
So can they have a problem? Yeah, their vision is going, not unusual. I have a friend in the UP, a good friend of mine, his name Grandpa Dan. He's 75. He has never worn glasses a day in his life. Doesn't need reading glasses, can see perfectly fine. And I said to him one time, how is it possible that you have never needed reading glasses? He said, I've never worn a pair of sunglasses in my entire life. Ever. He said, I don't even think I've had a pair on. I said, even as a kid? He said, we didn't have enough money to have reading glasses or sunglasses as a kid. So then I started looking at, there are actually exercises that you can do by looking at the sun at certain points of the day that actually stimulate your pineal gland, that actually increased your vision for healing.
Are you serious?
Well, here's my question. What does everybody tell us? Don't go where? In the sun.
In the sun.
Yet sun was one of the most healthy things you can have for your body.
Oh my goodness.
So things like that are just
Interesting.
Again, slips and fall. Oh, I didn't see that.
Yeah.
Vision, I didn't hear that. What? So
What?
that again, it's in essence hormonal shifts. I have some patients that have gone through menopause. Menopause is a decrease in certain hormones for women. I always laugh and say, do men go through menopause? The answer is, well, ask a guy who's hooked up on Viagra. He doesn't have the testosterone, low T. And what ends up
kind
happening...
of, right? There's like a change?
Basically the same thing.
Okay.
For women, you produce less estrogen. But you also produce, on a normal day, testosterone. I produce lots of testosterone. On a normal day, I produce estrogen. There's a small balance.
Okay.
As we get older, what do women do? Well, they decrease the levels of estrogen that are being produced.
Okay.
Their testosterone levels basically remain the same. So they get more manly. They get the little hairs, right? The little mustache, the little witch hairs.
Goodness.
They get more aggressive. They're usually more verbal. They take less crap from people. This is the testosterone coming out. And what do men do? Men's face soften. We get man boobs.
My.
We watch chick flicks. We cry all the time. It's because our testosterone is going lower, but our estrogen levels remain the same.
That's fascinating.
And so, again, these are the hormonal shifts. But remember also, with those hormonal shifts, you can have an increase in weight gain.
Yeah.
You can have a decrease in sex drive. You can have an increase in emotions such as anxiety, depression, frustration. Those are all affected by it. One of the things that most people don't understand in menopause and in menopause, that your cardiovascular function is not as taut as it once was. So I have friends of mine and patients of mine who want to train really hard, but they're never going to have the capacity like they did when they were not in menopause,
Right.
because the hormones are not there to support the cardiovascular function.
Okay.
And so some women will, and some men will say, I don't get the pump I used to in the gym. You're never going to, because
Okay.
you've given away your foundation. You don't have the hormone. So I've had women say to me,
Yeah.
should I take a hormone replacement therapy? I've read several articles that say an increase in taking hormone replacement therapy increases your risk of certain cancers.
Wow.
So my question is it really worth taking something outside? And usually it's a horse hormone product. Now, they may be changing them, but they were the horse hormone products. And for men, I'm not going to be 18. I understand that. My testosterone level is going to go down. It is normal. It is common. It is expected. And so for me to take a low T, I'm not 18. I don't want to perform like an 18-year-old in any capacity anymore because I'm not. My other parts of my body can't take that torment, torture, and terror either.
Yeah.
And so there is a normal declension in testosterone for me, and there's a normal expected declension in estrogen for you. You are born with only so many ovaries. That's why you go into menopause.
Okay.
You will stop passing those ovaries. Men, fortunate or unfortunate, we're allowed to produce, reproductive sperm for the rest of our lives.
Wow. Isn't that crazy? That's crazy.
Crazier than you would think.
Right.
And how about the cognitive changes?
Okay.
So when we're looking at things like Alzheimer's, we're looking at things like Parkinson's. Again, there's lots of research coming out because the boomer generation and the people who are now in their 60s and 70s and 80s, that population is getting higher. The amount of people entering that phase of life.
Right.
And so we're going to notice now an increase in gerontologic problems that go along with it. Mm-hmm. Let's say we had a boom in kids, mm-hmm. right? We're going to have a boom in kid problems. It just, that goes along with the territory.
Right.
And so we have to look at things like Alzheimer's. There's a lot of research with this. They're, again, recategorizing it as diabetes type 3. It's inflammatory.
Do you agree with that?
There's two things that have come across my path that I'm very interested in. One,
okay.
having it be recategorized. Two things sharpen my mind right away when I hear that. If it's going to be recategorized, mm-hmm. then there's going to be a drug. The pharmaceuticals hate vacuums.
Yeah.
And they're going to produce a drug to fill that vacuum.
Oh, man.
Fill that hole, right? That's number one. Number two, we are convinced, against, I think, better judgment, that we're born in a hospital. We're given a set of 78 immunizations by the time we're 18. We take a drug for every ill, every potion for every emotion, and then we die in a hospital. I don't think it needs to be like that.
Doesn't have to be that way. You're Italian. Italians don't do that. And
sorry, that's what we do.
Right?
So I'm not going to outdo those things, but I also want people to know that there are plenty of natural strategies to stop it. Okay. So when Grandma and Grandpa say, "But I always have pie after dinner," okay, you're sabotaging your brain, Grandma and Grandpa. But I really like, my 3 martinis at night. You're sabotaging yourself, Grandpa. I put sugar in my coffee, okay? You're sabotaging yourself. And so when I said you Lucky Charms, they're magically malnutritious, you're starting your day out with fiber, you're starting your day out with food colorings, you're starting your day out with sugar, and then you want to know why you're tired at lunchtime? And then you eat more sugar, right? Sugar in the morning, sugar in the evening, sugar at supper time. And then all of a sudden we're having a type 3 diabetes that are now affecting our ability to think and our ability to navigate.
And that's something that we can change.
We have the ability to prevent. At this point, there are not enough drugs in the pipeline, and I'm not a big fan of it. I'm not saying they shouldn't have it. I'm saying informed consent. If you want to take a drug, any drug that's being prescribed to you, I think you need to do your research and say, what are some potential side effects that this drug may have for me? What are some potential consequences? Because if you take a drug, every drug has a side effect. It's named with that because it's a side effect to what you want.
Right.
So if I take an anti-nausea medication and I poop my pants, that is the effect of the medication on me, but it did help me with my nausea.
Right.
And so we have a joke in our profession, right? Ask your doctor if taking this medication and 78 side effects is good for you.
Oh, jeez.
And so, one of the things that RFK wants to do is he wants to eliminate direct-to-consumer marketing. Us in New Zealand are the only ones that run drug advertisements on our TV.
Wow.
So there's only two countries in the entire world. And when I talk to my medical doctors who are patients of mine, I asked them what they thought about that. And what was very interesting is they said, we're selling more drugs than ever because they already know they're going to poop their pants if they take this. They don't care. They want the drug because they've been advertised with the drug.
Oh, my God.
And if you look at every drug advertisement, beautiful, healthy people. I mean, who wants to have some, No, they're selling a product. Cars are sexy.
Yeah.
Drugs are sexy.
Wow.
Right? COVID wasn't sexy. COVID was fearful.
That's for sure. God.
And so sex and fear sell. So the cognitive changes, Parkinson's is on the rise. The big thing that I'm always nervous with my gerontology patients is the idea that they no longer have the ability of processing information as fast as they once did. So their ability to multitask isn't what it used to be. Their ability to handle pouring coffee and cream and listening to the radio and signing a check isn't what it used to be all at the same time.
All at the same time.
And then the big thing in cognitive changes that I notice with people is a lot of isolation begins to create problems.
That's for sure.
And so, some of the nursing homes, some of the care facilities, one of the things that they try to do with their residents all the time is get them interacting. Come to the art department.
Right.
Come and watch a movie. Come and listen to reading.
Right.
Interact with
Make
people.
friends.
Absolutely. Isolation works incredibly well on the brain. So you and I are in prison, and we mess up, and the warden is going to put us where?
Like in
isolation,
solitary,
in solitary confinement. The brain for humans does not work very well in solitary confinement.
Wow.
And that's where these people kind of go a little bit nutty in solitary confinement, because as people, as a species, Homo sapiens, we are gregarious. We want to be around other people.
Yeah.
Now, there are people who will watch this and say, but I'm a loner. Okay, you're not a loner when you go to the grocery store and buy something. You're not a loner when you get gas in your car. You do interact with people. You do have a job. You do come in contact with people. But the more isolated you are, the more depressive and the more anxious you will ultimately become.
Okay.
That's why solitary confinement works so well. It changes the brain.
Wow.
So one of the things I tell people all the time is, especially young kids and especially, teenagers in their 20s, they want to be in a relationship. Dr. Christopher, I think I'm going to marry this girl. I'm going to marry this guy. Okay, fantastic. Can you be alone with yourself for a week and not worry about it? Or is this guy or gal that you're going to marry, is he going to be your crutch so that you're always interacting? What happens when he works the night shift and you work the day shift?
How are you going to handle that?
How are you going to handle that? And so it's not necessarily that we're working on isolation, but we're working on the idea that people they have a sense of comportment, right? They get along with themselves in the world.
Yeah.
And a lot of people don't like to be by themselves. They always want to have a radio going. They have to have a
right.
TV going,
Right.
some noise. I want to be on the phone talking to my friends and sending 14,000 texts a day. I want to be on social media. And then what we find is comparison is the thief of joy. And so everybody puts their highlight reel on Instagram and on Facebook, and that's not a reality. That's a mask. And so I fall in love with you. But I fall in love with you if you're wearing a mask. What happens the day you take the mask off and I say, wow, this is the real you?
Right.
I didn't realize that when we were dating and having those steaks, that Wagyu and Kobe beef. What's going on here?
What is going on? You feel kind of ripped off. You know what I mean?
There has to be obviously some authenticity to who we are.
For sure.
Let's move on to the next system, which is going to be the neuromusculoskeletal system. We know that there's going to be joint pain.
Yeah.
Arthritis is inflammation of it. We're slowing down. There are just things that we have to do. If I were to say to you, do you ever check your brakes? And you would say, well, of course, every 10,000 miles or whatever it is, I'm no mechanic, I have to change my brakes. Well, why? Oh, because they wear down.
They wear out, yeah.
And so what is big for the gerontologic age group? Knee replacements, hip replacements, elbow surgery, back surgery.
It's all the joints, right?
All the joints. And so what happens is the joints begin to wear down. How do we prevent that? We'll talk about that in just a minute.
Okay.
But one of the things that arthritis does is it blows up the joint with inflammation. Anytime you see itis, you're looking at an inflammation of neuritis, inflammation of the nerves, myositis, inflammation of the muscles, conjunctivitis, inflammation of the covering, the conjunctiva of the eye. So all kinds of wonderful itises. Colitis, inflammation of the large intestines.
Okay.
And so joint pain becomes real. And so people start popping what?
Yeah.
Anti-inflammatories, right?
Yeah.
And so we know that people who take NSAIDs, nonsteroidal anti-inflammatories, aspirin, ibuprofen, acetaminophen, there's around 16,000 deaths a year that are attributable to that. And that's taking that either the right way or the wrong way. Because at the end of the day, the nonsteroidal anti-inflammatories, one of the effects, even though it may be a side effect, is that it ruins your liver and kidneys.
Oh, my God.
Yeah, and so what happens when you feel good? You tend to use your joints more. I played adult hockey for years, and it was nothing unusual to have guys on the team who were older take 2 or 3 aspirin and wash them down with a beer. You're asking to basically take an ice pick and punch holes in your liver.
Oh my God.
And so there are some things that obviously go wrong with that. Again, I'm not a pharmacist. I do recommend people to check with their doctors and check with their pharmacist about taking it. Anything over the counter, I feel like I'm entitled to say, if you're taking it over the counter, you're not taking a prescription. Let's talk about the decisions you're making when you do that.
Okay.
Not all drugs that are sold over the counter are problem-free. And so you have to understand, again, that every drug has a problem, every drug has a side effect.
Right.
And so there's some things that we have to go over with it. Now, what happens when someone says to me, yeah, but I can't move my hands. I don't want to move. One of the things that I tell my older patients is 3 words. Same word. Move, move, move. Motion is life. Life is motion.
Okay.
Law of motion. Objects that are in motion tend to stay in motion. Law of inertia. Things that are at rest tend to stay at rest.
Yes.
So you must move to create metabolism within the joint. Well, what happens if I have no cartilage in my knee? I've talked to orthopedic surgeons, and what they say is when you can no longer take the pain or the problems that it brings with you, the insecurities, I can no longer function, then you get that done.
Okay.
But for me to say,
Not before.
yeah, I'm just losing a little bit of cartilage in here, should I get it replaced? No, that's not how that works. You got to degenerate the joint until it needs either total replacement or you're going to need some insertions that are going to be in
And that
there.
would be a doctor's decision, right?
That would actually is going to be a person's decision. I've had patients who always say to me, "How will I know
Right.
that I need a replacement?"
Right.
It's how do you know when you're no longer happy? You'll know.
Yeah.
Things aren't going to be happy. You're not going to be good.
No.
You won't want to go for the bike ride. And when your grandkid sits on your knee and you say, "Go to the other knee, it's killing me,"
Yeah.
you'll know. A lot of older people, as you know, don't live in colonials because they don't want to fight the stairs. And so,
Oh, exactly.
So you have to look at those things also.
It's so important.
So let's move on to the last one, and then we'll go over some subcategories and some
subcategories.
strategies.
Yeah, very good.
Emotional well-being. Older people have mental health issues too.
Yes.
For example, what happens when the kids leave the house and you're empty nesters?
Oh, gosh.
What happens when your parents begin to pass away and you see once that your dad was your hero and now your dad can't lift groceries out of the car anymore? You watch your heroes decline.
That's really hard.
Friends move away.
Yeah.
I don't want to be in Michigan anymore. I want to be somewhere all summer. But we've known each other for 50 years. Where are you going? And
That's tragic. That's like a loss. Like you'd have to grieve that friend.
how about a spouse that passes away? I'm dealing with a friend right now. He'll be 85 at the end of the year, and his wife of 60 years passed away recently. He's got to go through the stages of grief, which are real, but he has to come to the acceptance that this is the end point of a relationship. And so we ride him really hard about staying active with his socialization, stay away from isolation, make sure you're coming to the gym with us, make sure you're doing things that are going to
You guys are
put
looking out for him.
Absolutely. He's our friend. We love him very much. But when someone passes away, those stages of grief are real. To deny them, like a river in Egypt, right? It's denial. Stay away from it. Accept it. Set your camp up there. Why would you be upset that your best friend, your lover, the mother of your kids, for 60 years is gone? If you're not sad, you may have other problems.
Yeah.
Right? Especially if it's been a healthy a marriage. Grandkids. They come and they go, Grandpa, I want to play cards, I want to play Yahtzee. Pretty soon they don't have time to go visit Grandpa or Grandma. So, there are things for the
That's
emotional
loss,
well-being, even
too.
for older people.
Right.
You start attending more funerals.
That's hard.
Your friend gets diagnosed with something that he's not going to beat. And the unfortunate part is that every one of us is going to have to participate in is we're going to have to face our own immortality. Death is the ultimate champion here on this plane.
We can't win.
It is undefeated.
Yeah, that's true.
And so sometimes when you look at an opponent in the eye, you can stare him down for a while, but eventually you're going to have to put the gloves on and you have to go in the ring.
Yeah.
And he is undefeated. He is
That's
undefeated.
So true.
And so, we can have a whole nother conversation about Christianity and afterlife and all that good stuff. I would love to have that.
I
My
love
favorite
talking
subject.
about things like
Yeah, we'll do it.
I love that.
But we face our own immortality. And I tell my wife all the time, I hope I pass away before you do because I don't want to be without you. You're going to be stronger without me than I'm going to be without you. And I'm now at 62. I'm learning that I am going to die. And I'm accepting it. It's going to happen. I don't know when it is. As a Christian, if it happens tonight, thank you, God. Thank you, Jesus. I'm happy for that. I'm home.
Yeah.
And I won't worry about what my family does without me because God will take care of them. And I'm not going to worry about it. But everybody has a little bit of that fear, a little bit of that trepidation till the moment, right? I've thought laying in my bed, crying myself to sleep, how am I going to tell my kids Dad's not going to make it? But again, undefeated.
Yeah.
But they know I'm not going to make it because I keep on saying to them, your dad's getting older. I don't plan on going anywhere next week, but you never know. And, recently I had a kidney stone removed.
Oh, God, was that painful?
It was the most painful, second most painful thing I've ever experienced in my life. But besides that, what I'm realizing is there are little things that are going wrong with my system.
And you're healthy. You are vibrant.
I consider
you are
myself to be
just so
healthy.
well informed.
But he's undefeated.
Yeah.
And he brings you right to the mat with a pin. Slaps the mat and says, you know what? See you later, Tiger.
It's your time.
Yeah.
Oh, no.
So why don't we go over some subcategories that I want your audience to just at least begin to pay attention to.
Right. So these are things that can sort of result from or that kind of thing of what we talked about.
Okay, so there's 16 of them, but we're going to go fast because we're running out of time. First thing is this, loss of independence. A big thing that older people fight is they're going to ask for help. I can't do this on my own anymore.
Yes.
So, a condominium. I no longer have to cut my lawn. I no longer have to shovel my driveway. And people think, oh, that's fantastic. Isn't mowing your lawn and isn't shoveling your driveway a form of exercise or movement?
It is.
Sure, of course. But a loss of independence. How about this one? Dad, I need the car keys.
Oh, my God.
Right? So
that's a
loss
horrible
of
thing.
independence.
Oh, my God.
Dad, you're peeing your pants. You need to get some adult diapers. It depends of some kind.
That's so hard.
Right? So loss of independence. Next thing, you see your health begin to deteriorate.
Oh, my God.
For example, I'm now getting liver spots on my hands.
You are?
I'm starting to see that my hands and my skin is beginning to deteriorate. And so what happens is it's going to happen. Carter's little liver pills for Carter little liver spots. And so we know that there's going to be some declension within all systems. Now, what's interesting that I haven't quite figured out yet, and I'm not going to be a student of it, I'm going to die of old age. Okay, why did my heart not give out, but my liver did? Why did my intestines shut down, but my heart didn't? Why, as someone who has Alzheimer, every other system in my body is working extremely well?
Except.
And so there's going to be a deterioration, sometimes with one, but sometimes it's going to be systemic. The heart and kidneys work together. So usually heart disease, you're going to have some kidney problems.
Right.
And so we have to look at those things. So we look at things not only as an overall system, but we look at things independently. Right. So you go to a heart doctor, you go to a liver doctor, you go to a lung doctor. But nobody wants to go to a GP or general practitioner anymore because they want to go to the specialist right away. Well, the GP is designed to say, let's take a look at a few things before we send you to Dr. X, who's going to do a little bit more in-depth.
And he might be able to order tests that would give him a clearer idea of what exactly is going on, right?
Absolutely. I'm suffering this, and my wife will tell you, loss of memory. And she'll say to me in the nicest of ways, "You've told me that 3 times in the last 2 days." And I say to her,
"That's painful.
I don't remember saying that, honey." And and I have to come to the determination that there are little things that are beginning to break down. I say to friends all the time, I may have said this to you before or asked you this, so please don't be mad if I did. And you ask them the same question.
Yeah.
And how many times have we heard this in our common culture? Don't obtain items, build memories. Do things that are going to build a memory. Don't buy another car. Forget the new pair of roller skates.
What if
build
you
memories.
Begin to forget things.
And I think in the back of my mind, where do I put the key to that new car, and where were my new roller skates? I can't even remember that anymore. By the way, what did we have for dinner last night? And we start, as much as you and I are laughing, we laugh out of identification and association, not of the fact that, hey, Sue, when was the last time that Dr. Christopher was with you? I don't know. It was 2 days ago. And so obviously there's memory loss. There's we talked
That's
before.
hard.
There's a decrease in cognitive function.
Right.
You just don't absorb information like you used to. We see that there's more isolation with older people.
Yeah.
It's dark. I don't want to drive at night, and so they don't do nighttime things.
That's true.
If you're
That's
ever
true.
on the road between 7 a.m. and 2 p.m., there's a lot of blue hairs out there driving. But if you go more towards 5 o'clock and 6 o'clock and 7 o'clock when it's dark and the traffic becomes much more,
Not at
all the older people are staying home. They don't want to have to deal with that.
So right.
And because of a decrease in cognitive function and isolation. Big thing that we're about my friend,
Yeah.
there's a feeling of being left out. He said to me, I used to be at the head table of everything. He said, now I'm at the table with the kids.
Oh my
And again, there's a feeling of being left out. Hey, we're
That's
going on a family vacation. Should we bring Grandpa? He's going to slow us down, and he's got to change his diapers. And
But imagine
we-
if you're grandpa. How
Right.
much does that hurt you?
I'm thankful I'm a grandpa, but at this point, my beautiful grandson Tommy, he can sit on my knee and we can have fun. He doesn't care if Grandpa has diapers on, which I don't. But
You
eventually
don't.
he's going to come over in 18 more years. I'm going to be in my 80s. I'm not going to be around. I don't know. So he's going to have to come to that. Financial concerns for older people. You had a
big one.
guest on earlier that was talking about financial strategies.
Right.
Finances become very important as we get older.
Very
Big
important.
thing is, as we're feeling left out, more isolation, a decrease in cognitive function. What's my purpose? Where do I find my purpose in life?
Kind of lost because things have changed. So the things that used to give you meaningfulness and the things that you used to work for,
Absolutely.
whole
Not what they
different
were.
paradigm, right? It's like
Yeah.
a paradigm shift.
Absolutely. Absolutely. Number 9, as we're moving our way through, is you become a strain on the system, right? So the government's going to cut checks. What are they going to cut checks for? Medicare, Social Security. What happens when there's no more moolah? Oh, we're always going to cut Social Security. So there is a strain that older people put on the system. It's not bad or good. There's a saying that says it is what it is.
Yeah.
I mean, what are we going to do? Eugenics for everybody who's after the age of 65 who can't pass a basic cognitive exam and can't drive a car and they're peeing their pants? And so
No.
it becomes a strain in the system.
That is true.
Sorry, I don't
It
mean
just
to be
is,
that way.
right? Like, because everybody's working to earn their keep. But, I mean, but if you've had a lifetime of working, you shouldn't feel bad. Like, just accept what you've earned in a way, right?
Yep. Older people fall more.
Yes.
They break more things. They are emotionally less flexible. You kids, when I was a kid, we never talked to our dad like that.
Right.
I mean, do we need to go through the plethora of old sayings that, grandmas and grandpas say to their grandkids? I walk to school both ways, barefoot uphill.
Uphill.
Grandpa, how can you possibly walk one way uphill and not the other way? Shut up, kid. Right? So there's a loss of emotional flexibility.
Yeah.
Unfortunately, there's a loss of looks and beauty. Saggy skins, things are drooping, things point to the ground. There's, bat wings, beer bellies, false teeth. I mean, you name it.
Yeah, that's
right?
pretty sad.
Yeah, the makeup doesn't do what it once did.
No,
I mean, I put makeup on this morning. It's terrible right now. I have to get a new brand. Same things are happening.
No, and it is. That can really affect your self-esteem.
Of course. Of course.
You know?
I mean, I love it when I see older people wearing modern clothes.
Yeah. Because, good for you,
catching
right?
up with the fashion. And then an older person will say this, why am I wearing new fashion when I have a closet full of stuff from the 1960s that's paid for? Because there's a strain on this system. Am I going to fall? I have more isolation. I'm concerned about my finances. What do I need a Louis Vuitton purse for?
Look at all those things. It's like
Yeah.
check, right? Like,
Yeah.
and those are true things. Like, yeah, like you can keep wearing your clothes years after. I definitely do.
Yeah, for sure.
You know?
My wife says to me, you're the only one I know that has 40 skinny ties waiting for them to come back. I said, honey, they're coming back.
I love skinny.
They're coming back, babe.
I love skinny ties. I love.
Are you
them.
old enough to remember elephant bell bottoms?
No.
Bell
What's
bottom
an
jeans
ele-
I mean, it was just wide.
Okay,
It wasn't just
no.
bell bottoms. I mean, they were elephant wide.
Wow.
They're coming back, man.
Coming back.
I got my pair from 72. They're going nowhere.
Do you have a leather skinny tie? Because I did. A leather skinny tie? No, that was pretty
Honey,
cool
if you're
in like
watching
the 80s.
this, you tell them no.
Right, tell them no.
Healthcare
yeah.
landscape, right? Do I get Medicare Part A, Part B? What do I get, with the landscape, with Medicare landscape? Do I need to go see Dr. Snagglepuss before I see Dr. Smith? I mean, there's all kinds of things with
A lot of
with the healthcare
decisions,
landscape.
right?
Sure. This one is kind of tough. You feel unsupported. Like my father's passed away. Now, can I tap into my older patients and tap into my older friends, who are in their 70s and 80s and kind of get an idea of what am I heading for, that kind of thing. But when you get older, you start feeling unsupported because
so
you're going through some things, which leads to this right here. You lose the relationship to the times. The culture has begun to pass you by.
Oh my God.
Music
and
right?
Yeah, culture.
I mean, everything. And the interesting thing is, the Apostle Paul says in the book of Romans, don't be like this culture. Be transformed by the renewing of your mind. He says that the culture creates its own problem. And in that word, that Greek word culture, we get the word seculum. And we know what secular things are. Secular things are away from other things. It's secularized out, right? You go to a secular school versus a parochial school. And so don't be like the culture. But we have to be like the culture at times. My friend who's in his 80s, his computer savvy destroys mine.
Oh my God.
He texts faster than anybody I know.
What?
I mean, it's amazing. And he does things with his computer. He loves it. He's technologically good, but he's active in his life. But he can't relate to other things that are going on. I can't. Here's a classic. Don't these kids go to school anymore? They got a snow day. When I was your age, I never had a day off because it was cold. You put a scarf on and you went to school. But see, I'm going to be 63 this year. I'm losing the ability to relate to the times.
Yeah, I understand that.
And so there has to be, again, that plasticity or that flexibility to say, okay, I don't know, how am I going to learn to know? And then the other thing is there are people who are coming in to my practice that may be on 5, 6, 7, 10 different medications. And then the medications create their own set of problems and side effects for older people who are forced to take or choose to take a medication. And so there's usually not a concert of doctors getting together and saying, hey, I'm taking care of Sue for this. Oh, I'm taking care of Sue for that.
No.
But I'm taking care of Sue for this other thing.
Right.
And you're on 6 different medications, and the other doctors don't necessarily pay attention to or know about the medications. And so the medication and interaction with the medications can become a real deal. So why don't we take the last little bit and go over things that you can do.
Very good.
Fair? And we'll wrap it up. I think we have a
about it? Because now we're aware of all these things that we could go through. So what can we do about it?
First thing, start learning early in life about how to prevent your body decaying and to create more vitality.
Okay.
For example, research shows that girls have the ability to prevent serious osteoporosis between the ages of 15 and 25. What are girls doing between the ages of 15 and 25?
Kind of dieting and kind of they're
junk
not
food,
really taking care of
just discovered alcohol in college.
Yeah.
Hey, are you going to smoke the end of that? I mean, there's all kinds of dumb things that we do as people. I'm not picking on girls by any means. Guys
No.
are way dumber than girls. And so we have to learn to start early on how to begin to take care of our body. And that means parents need to understand that food dyes are not good for their kids.
Right.
They need to understand that they can't feed their kids sugar in the morning, sugar in the evening, sugar at supper time,
Right.
and wonder why they can't focus. And so diet becomes incredibly important. Diet affects every system that we have in our body. You want to prevent muscle loss? You better make sure you're having the right amount of protein, fat, and carbohydrates. You want to prevent Alzheimer's? Get off the junk food, polyunsaturated fats, ultra-processed foods. There's all kinds of things that you need to understand. My golden rule for people who are changing diet is this. If it comes in a package, get rid of it.
Wow.
Shop on the periphery of the store. As soon as you go into the middle, that's where all the junk food stuff is. And remember, the tobacco industry has taken over the junk food industry.
That's shocking.
They know how to get you to eat bad. Exercise. I'll start the sentence, you finish it for me. If you don't use it,
You lose it.
you lose it. Move, move, move.
Okay.
And even that fosters a sense of dependence. High intensity interval training or HIIT training actually increases your ability to recover, to think, to emotionally regulate, to emotionally downregulate. There's all kinds of things. All of those things by simply exercising. The next is hydration. You're a dry noodle.
I know,
What do you need to
I'm
put it in? Water. Water everywhere, not a drop to drink. Now, for example, we're drinking out of plastic containers here.
We are.
I would tell you to go and start drinking out of glass containers because of all the microplastics that are in there. So hydration is important. The next one is proper sleep. I tell parents under the age of 12, kids should be getting at least 10 to 12 hours of sleep a night.
Wow.
Your teenage years, unfortunately, exactly the same.
You know what? But the blue light and the cell phones,
you
and
don't
this is
say.
a problem.
Yeah, absolutely.
It is.
Kids go to bed with their phones, right?
That's
in the bed with their phone.
problem.
So as an adult, I try to get between 8 and 10 hours of sleep a night.
Very good.
And people will say things like, "Yeah, but how do you watch TV?" I don't. I go to bed. I read and go to bed.
You actually
yes,
end
cut
the
it off.
day, like
Cut it
literally
off.
end the day. Yeah.
Exactly right. And then you have stress management. What are things that stress you out? Manage them. Life is stressful. Life is anxious. Life is depressing. Life is frustrating. We get all that. There's a general amount of that makes us who we are. And so learn stress management ways. What do you eat when you're stressed? You
Bad
don't eat a
stuff.
salmon.
Yeah,
You eat
bad
junk.
stuff. Yeah,
right?
exactly.
And so diet becomes also dental health for older people, right? Cavities, teeth are falling out, dentures. Everyone has to eat. So taking care of oral hygiene. There is a very close relationship to your oral health and your cardiovascular health
Wow.
via the vagus nerve. So there are things you can do to make sure you're taking care of that. Do things that create an active mind and cognition. Crossword puzzles, Sudoku, reading, puzzles at home, knitting.
Friendships, right?
Yeah, absolutely. Absolutely. So an active mind and cognition go an extremely long way.
Okay.
Care for your skin. Get a massage. Get a facial. Take care of your skin. Have the right components. If you notice, there's a lot of new makeups coming out with tallow-based makeups and tallow-based cream because tallow is beef fat that's very good for your system.
Wow.
Good to cook with too. And so they're trying to get rid of some of these artificialities and going back to more natural things.
Good.
What do we get as we get older? Skin cancer, basal cell cancer, the little liver spots that we're talking about.
Right.
Those are all things that...
They show up in your skin because
Absolutely.
of just different things going on.
And remember, your skin can be part of the elimination system. You get pimples, get blisters, get atopic dermatitis. I mean, there's all kinds of other things. Dry patches, psoriasis, eczema. Those are all things that can affect an older person with a skin condition.
Wow.
And then the one I think that is probably the most important is learn from an early age that there are constructive versus destructive survival patterns. I'm going to smoke and drink and not exercise. That is a destructive pattern.
Yes.
I'm going to argue with my wife all the time. That's a destructive pattern.
Yeah.
I'm never going to read anything that's going to cause me to grow. That's a destructive pattern. So learn early on that you're going to build on constructive survival habits or values.
Interesting.
And when we start doing those things, we're going to see that the momentum adds up. If I smoke and drink and don't exercise, those destructive survival patterns are going to add up and create a momentum. The more positive things I do that are healthy for my system, the more positive momentum we're going to build towards health and wellness and well-being.
It's almost like a threshold or like a critical mass.
Yeah.
It can propel you in the right direction.
Absolutely. And remember this, there has to be stress on the system to grow. So don't run away from stress. Learn to manage stress. Learn to make stress part of your constructive survival value.
And I think, too, like faith, right? Like we both, really, really...
That's a
it's
whole...
so central, isn't it?
20-hour subject right
yes,
there.
Yes, it is.
But you know what? Faith is a beautiful thing. And when someone said to me the other day, "Do you have any addictions?" I said, "I'm addicted to the most crazy thing you've ever heard." They said, "What's that?" I said, "I'm addicted to hope."
That's beautiful.
I'm addicted to hope. I hope tomorrow will be a better day. It never runs out. There's an endless supply of it.
Wow.
And hope leads into faith.
That's beautiful.
And faith leads into love, and love is the greatest of those three. Because love is kind, love is generous, love is patient, love is never rude. But it has to start with hope, faith, and move to love.
That's beautiful. Yeah, because it's important.
Constructive survival value.
And it's true. But we kind of covered a lot of things that, things you have control over. Right?
Sure.
Things that you can think about, even if you're kind of like, okay, I'm not ready to give that up today, but let me start reading about it or whatever. And then maybe a month from now, you're like, okay, I think I'll give this a try, whatever. But it's good because it's going in the direction of health and not away from.
Have you ever seen an elephant and there's 5 blind guys around the elephant?
Oh,
and they
I've
say,
heard of that.
Hey, describe the elephant. One guy
Yeah.
says, oh, they got a big, thick leg. Oh, there's this long thing. There's this skinny thing in the back. Big ears. Okay, you're looking at one thing,
One thing.
and you're dividing it up. You must look at the whole part and then find your subparts. But at the end of the day, making these constructive value changes is like eating the elephant. It's going to be one bite at a time.
That's right.
Go small, gain some momentum, pick up the momentum, and run
Yeah.
with it. It's okay.
That's
And be
all right,
prepared for
yeah.
failure. You're going to fail. It's built into the system.
But I feel like you're very holistic in your whole approach to chiropractic as well. Like you're always, whenever you explain things to me, you're always like, and this is the effect on other systems, or this is what else could happen. Like you're always like very holistic, and I think that's really like the best way to be in medicine.
If I were to poll my patients, my older patients, people who are, I'm going to say, because
That
I'm
have seen you
62,
for
right?
years.
These older people who are 65 and older, even if I went 70 and older,
Yeah.
I will ask them, I'll say, what is one thing you wish you'd have paid more attention to when you were young or growing up? Nearly 100% of them say this: I would have taken better care of myself.
Wow. So more than money?
More than money. More than money.
Interesting. Wow.
They say, I wish I would have taken care of myself.
And that's
Money may be
something-
number 2 or number 3,
Yeah.
but they've always said to me, I wish I would have taken better care of myself.
goodness.
And this is an hour of power that we just had right now with some good strategies. Again,
Yeah.
employ them.
Absolutely. Yeah, we're rooting for you. Like, honestly, if you'd like to see Dr. Christopher and actually talk to him in person, come and see him at a very, very good location that he's at in Troy, Square Lake Road and John R. Yeah,
Bet.
spinal joint, discovers chiropractic. It's such a pleasure.
Thank you. Always a
Thank
pleasure to be here. I'm
you.
humbled.
Thank you so much,
You bet.
Dr. Christopher. I learned so much from you. And I know you can make faces at me because I like chips and chocolate, so I'm kind of doomed. Like I know. Look at his face.
I hope this is being recorded.
It is.
If you're going to like chocolate, make sure it's dark chocolate.
Okay.
80% cacao. You should be okay.
Thank you.
And if you look at the bag of chips, it should say 3 things: potato, salt, maybe vinegar, oil. Don't go for the ones that.
Potato should be the first word.
Yeah, it should be. If you don't know, if you can't read a bag of potato chips, put it down.
Put it down.
I
That's
literally
right.
put it down.
Thank you so much.
You're
Please
welcome.
come back again.
Thank you.
Thank you for watching, and have a nice evening. And hopefully we've given you some good things to think about. And, we're always positive. We're happy to be, at least we're here and we have choice, and we have control over some of these things. And so just choose to do a little bit better, in different areas, a little bit here at a time, right?
For sure.
So we'll talk soon. Thank you so much. Bye-bye. We did good for time. This is what you wrote to me, I think probably before our first show. So if there's anything there we could check